Okay, so this next question, I see people ask this question all the time, and I feel like who better to go to than the labor and delivery nurse herself. So what are the essentials that you packed in your overnight bag or your hospital bag that you would recommend moms to look out for and pack in their own bag?
I'm not going to go over all of them because there was, quite a few, but I'll go over some of the tidbits. So first of all, what I did was I shared this on my Instagram of stories of like how I packed my bag and what I kind of did. And I have always, since I've known my husband, packed his bag for every kind of trip that we've gone on. That's just what I do. And that's just, it's almost like, I don't even think twice about it. Like, I just pack his bag. So
Yeah.
I got a lot of messages of like, cause I went through, okay, I packed my bag, I packed my husband's bag, I packed a little bag for like the baby. And that's kind of how I thought of it in my head of, categorizing it out. And that's how I posted it. And I had a lot of people be like, you packed your husband's bag? Like he can't pack his own bag? I was like, well, I mean, he can, but I've always done that. So,
Yeah,
so
yeah.
just to
Very
preface,
plan
yes.
ahead, yeah.
Yeah, I did pack my husband's bag. So that's what I want to first start off by saying is that's how I kind of organized it in my brain. Is you can put it all in one bag, it doesn't matter, but for me, I at least like to have like a little separate bag for myself, a little separate bag for my husband, and like a little mini bag for any kind of baby stuff. And then I think I put the baby stuff inside my bag just so I knew, but that's how kind of like organized it. So in terms of let's go over a few things that were like in my bag. So working at the hospital and seeing how the showers sometimes get cleaned. Not going to say this is how it is everywhere, but I did put just an old pair of flip-flops in my bag. Just if you've gone to college and showered in college dorms, like that's college days. Like that, I always wore shoes when I showered in college. So I like brought my college days back, put flip-flops in my bag to not have my feet go on the tile. So that was in my bag. For labor, one thing that I definitely packed in there, you go over all the, I brought some clothes, home clothes for me. I brought like a little gown for me that I wore during labor and just some comfy kind of sports bras. In terms of afterwards, I did bring a bunch of like open shirts. So I brought like a few PJ tops that were, you just like button them for because I planned on breastfeeding. So I brought those, and I always say that's better than using just like a t-shirt, especially when you're first starting out breastfeeding and breastfeeding a newborn. It can be really hard to breastfeed like that. Like it's so much easier to have a shirt that actually buttons open or zips open. So I definitely brought those. Let me see what else is on my list. And then I forgot for labor, I am a puker. So I brought a bunch of stuff that was like I brought some of those preggy pops. I don't know if you know what those are, but they're like help with nausea. Yeah, I brought like little essential oil roller that I used for nausea. Just a few things, and I brought like I make sure I had some Zofran that for nausea. So I knew that I was going to be puking during labor, so I made sure I brought some extra stuff for nausea and vomiting. And then going back to afterwards, my stuff, definitely brought a nursing pillow too. So the pillows at the hospital are fine. I mean, you can use them for breastfeeding a newborn, but I think I brought my boppy to the hospital, and then I used my breast friend at home. But I love to tell moms about those nursing pillows. I just think they provide a lot of support especially when you're first starting out and you're breastfeeding a newborn. So definitely brought that to the hospital. I just washed it, when I came home. And then for me as well, I brought my own pillow and I just came home and washed that as well, because I knew that I sleep a heck of a lot better on my own pillow than like a hospital pillow. So those are some of the things in my bag. My husband's bag, I don't have to talk about it, like his just normal husband stuff. For baby, one thing that I definitely always recommend to bring for that first meconium poop that they have, it's very, very sticky, and it can stick to their little tush. So I brought a little tube of Aquaphor. It's like, just Vaseline. And what you do is, before they even go that first time, sometimes they kind of come out and it's on them, but and you kind of can't do anything about that. But if they haven't had their first poop yet, you just kind of smear on a little bit of that Aquaphor or Vaseline, right, in their bottom and all over, kind of their bottom in the diaper and stuff. And it'll get on the diaper. And that will help with the stickiness when you wipe for that first meconium, and just make it a whole lot easier to clean. So I love to tell people about that little trick. And I certainly did this. I did that the first time with Walter. I did it the second time with Rylan. So that was definitely one that I packed in his bag. Another two were little nail clippers. He did have a couple of little straggler kind of nail, hang nails coming out. Some babies do. You might need to clip a little nail. You just have to be careful. Some babies don't, but I just had that in my bag as well. And then little hand mittens. So those are nice because they do have a tendency to really scratch their face, and it just makes me sad when I see them like scratching their face.
Yeah.
So those are just a few.